Hello and welcome back. I'm your physician, and today we're talking about something so many of my patients feel embarrassed to bring up, but I promise you, it's one of the most common things I see in my clinic, especially in patients over 60. We're talking about toenail fungus. If you've noticed your toenails becoming thick, yellow, brittle, or oddly shaped, over the past few years, I want you to know two things right away. First, you are far from alone. Second, this is very treatable. And understanding why it happens is the first step to getting your healthy nails back. Why toenail fungus becomes common as we age. Let's start with the why. Toenail fungus, which we call onychomycosis in medical terms, caused by microscopic fungal organisms that thrive in warm, dark, moist environments, which unfortunately describes the inside of a shoe perfectly. Now, here's what surprises a lot of my patients. This condition becomes dramatically more common as we get older. By some estimates, nearly half of adults over 70 will experience it at some point. Why is that? A few reasons. As we age, our nails naturally grow more slowly, and slower growing nails are less able to outpace a fungal infection once it takes hold. Our circulation, particularly in our feet and lower legs, also tends to decrease slightly over time, and good blood flow is one of our body's best natural defenses against infection. On top of that, our nails become naturally drier and more brittle with age, which creates tiny cracks and openings that fungus can slip into. If you have diabetes, poor circulation, a weakened immune system, or you've had athlete's foot in the past, your risk goes up even further. And if you spend time in communal spaces, swimming pools, gyms, nail salons, barefoot, that's another common entry point. What to look for? So what does toenail fungus actually look like? In the early stages, you might just notice a small white or yellow spot under the tip of the nail. Many people brush this off, but as it progresses, you may start to see thickening of the nail, sometimes to the point where it becomes difficult to trim. A yellow, brown, or greenish discoloration, a brittle, crumbly, or ragged texture, the nail separating slightly from the nail bed, and in some cases, a mild odor. If left untreated, it can become uncomfortable, especially when wearing shoes, and it can spread to other toenails, even to the skin around them. Why you shouldn't ignore it, and I want to gently push back on something I hear often. It's just cosmetic. Doctor, I'll live with it. I understand that impulse, but here's why I encourage my patients not to simply ignore it. First, fungal infections don't resolve on their own. They tend to slowly worsen over months and years if untreated. Second, a thickened, misshapen nail can actually press painfully against the inside of your shoe, and for older adults, foot pain is a real contributor to reduced mobility and even fall risk. Third, and this is especially important if you have diabetes, any break in the skin around an infected nail can become an entry point for bacteria, which can lead to more serious complications in people with reduced circulation or nerve sensation in their feet. So while it's rarely an emergency, it is absolutely worth addressing. What actually helps? Now let's talk about what you can do. I always recommend starting with a visit to your doctor or a podiatrist, because there are actually several other conditions: nail psoriasis, nail trauma, certain nail dystrophies that can look similar to fungal infection but require completely different treatment. Nail clipping sent to a lab can confirm what you're really dealing with. Once fungus is confirmed, treatment options generally fall into a few categories. Topical antifungal treatments applied directly to the nail work well for milder or earlier stage infections. They require patience, often several months of consistent daily use, because they need to work with nail as it slowly grows out. Oral antifungal medications tend to be more effective for moderate to severe cases, particularly when multiple nails are involved. These are prescription medications, and your doctor will want to check your liver function before and sometimes during treatment, since that's a known consideration with this class of medication. There are also newer approaches, including certain laser treatments, which some patients pursue, though the research on how consistently effective, these are long-term. Is still developing, so it's worth having a candid conversation with your provider about realistic expectations. And in more severe or stubborn cases, especially when the nail is causing pain, a doctor may recommend removing all or part of the nail to allow topical treatment to reach the nail bed directly, or to allow a healthier nail to grow in. Prevention matters just as much because fungal infections can be persistent and sometimes recur even after successful treatment. Prevention really matters. A few habits I recommend to my patients: keep your feet clean and thoroughly dry, especially between the toes after bathing. Choose breathable shoes and moisture-wicking socks, and change your socks daily. Avoid walking barefoot in public showers, locker rooms, or pool areas. A simple pair of sandals makes a real difference. Don't share nail clippers, files, or shoes with others. If you get pedicures, choose a salon that properly sterilizes its tools, or consider bringing your own. And trim your nails straight across rather than rounding the corners, which helps prevent both fungal entry points and ingrown nails. A final word: if there's one thing I want you to take away from today, it's this. Toenail fungus is common, it's manageable, and there is absolutely no reason to feel embarrassed about it. But it is also not something that fixes itself, so if you're noticing changes in your nails, please don't wait years to mention it to your doctor the way so many of my patients do. Your feet carry you through every single day of your life. They deserve a little bit attention too. As always, this video is for educational purposes and isn't a substitute for personalized medical advice. Please talk to your own doctor about your specific situation. If you found this helpful, I'd love for you to like this video and subscribe for more conversations like this one. Take good care of yourselves, and I'll see you in the next video.